Hi there, my name is Dr. Terry and I'm known as the Skin Energy Doctor. Today at my clinic in 10 Hardy Street, I'm going to share with you one of my most favorite treatments called the PRP treatment for the face. Here I have one of my beloved and long-standing patients, Sylvia. She has relatively very healthy lifestyle. So what we're going to do today is she's complaining kind of loss of volume kind of around her eyes and around her cheek area, but particularly her main concern is around her lips, really, what we call the smoker's lines around that part. Now, as you know, smoker's line, we can treat it with dermal rollers, peels, or even lasers, or even fillers. But what I found with the PRP treatment, it's a very good and subtle treatment as well. Now, this treatment is called PRP, or platelet-rich plasma. It uses the regenerative properties of your platelets, of your bloods, which contains a rich multitude of growth factors, hormones, antioxidants, and antibacterial. It's very good to use for aesthetic, orthopedic surgery, plastic surgery, and scars and treatments of sports medicine as well. Some people, have always talked about fillers and the side effects of fillers. However, PRP is all natural because it's all coming from your own cells. Now, today, Sylvia, we're going to go through the treatment with you, so you will see what we're going to do. Okay, so first things first, I'm going to mark Sylvia's face, or what area we're going to do. Okay. She's lost some volume in her laugh line area, or what we call nasolabial folds, and also lines on her upper lip as well. Now, when that happens, the olden days is we just fill that up with a filler, and that's what gives you the chipmunk look. Now, these days, what we found is that happens because we lost the volume up on the cheek area. So if I lift that up, you can see that it's lifted up already. So if we look at the areas where Sylvia has lost volume. Okay, so she's lost some volume in the cheek area and down that area, and she's got this area here as well, and she lost some volume here as well. Now she's always been a slim lady, but she's got some sunkenness here really, and that's, as we grow older, that can happen, either go in or kind of like sags down really. So what I want to do is kind of fill that area out here. And she's got a little bit of jowls, just turn that on. Yeah, so it's just a little bit just on that area, because what happens is when you lose the volume there, this becomes loose and that everything just drags down, and that's when we get what we call the jowls. So what we want to do is put a little bit of strength in there just to give that lift up and pull that area, so to give that lift up, okay? And then afterwards I'll also fill these parts up here just to smooth that area both sides. Okay. PRP, because it's using your own natural cells, it does take a while for it to regenerate. So you will see some results now, but it will take up to 3 treatments really for maximum results. So we always recommend patients to come back about 3 to 4 weeks time to have a repeat treatment, 3 to 4 sessions, and then you have a booster session every 6 to 12 months. Okay, so I'm going to clean your face now. So first thing, I'm going to take a sample of blood. Now, the amount of blood we take is less than what they take for blood transfusion or blood tests. Okay, good. Now, when we do PRP, the results you get really depends on the system that's being used to harvest your plasma, and also the technique used. Now, one of the important distinction, the blood tubes basically needs to be glass. Okay, the company that I use the products from is called RegenLab. It's a Switzerland company that basically specializes in regenerative medicine and research of regenerative medicine. So you want to make sure that it's a glass tube, okay, and so that it can basically separate the plasma appropriately as well. So after 5 minutes of centrifugation, basically what happens is it separates the blood, the full blood, into red blood cells, which is kind of reactive, and we don't want that. And this is the separator, and your plasma, which we call it like a golden liquid. So in your plasma, it's got platelets, which is rich in growth factors, and also it's got hormones, antioxidants, and nutrients. So imagine this all, all these nutrients basically re-injecting it back into your skin. So superficially for rejuvenation, and deep for volumization. One thing great about Regen PRP kits is that you have the blue tubes, which gives you your plasma. Okay, so that's one. But also it has the red tube, which basically gives separates what we call a thrombin serum. And a thrombin serum is a natural trigger in your body to basically start the coagulation process or cascade. So when you cut yourself, it basically get your healing process started and triggered off straight away. So one thing great about the RegenPRP kits is that with using the thrombin serum through their red ATS tube, we can actually create like a filler from your plasma and re-inject it back into your face, really, or any part of your body. So it's a completely natural treatment. The one thing nice about PRP is you can mold it. So unlike fillers where it kind of sticks where it is, PRP is quite nice because you can mold it while you're injecting it. It's very good for defining the jaw and neck as well, so it's a very good treatment for that. Just tilt your head there. Okay. And with any injection type procedures, always a risk of bruising, so you want to make sure you're not on any anticoagulants or aspirin beforehand. And if you're on warfarin and heparin, there is a conjugated indication that you may not be suitable for treatment, or because we can't coagulate it as you would in a normal patient, so the treatment may not be as suitable for you, or may need a lot more treatments for you, so it may not be the most suitable treatment for you, so discuss it with your practitioner to find out which is best for you. Now the next part of this treatment is basically what we call mesotherapy. So before we did a bit deeper for volumization, and this is more mesotherapy. It's kind of superficial, multiple injections on the top layer of your skin, so kind of like giving a boost of nutrients in your skin, okay? This is very popular in France, this treatment. So the final part really is just to massage the product into the skin and to mold it so that it gives the shape as we want. So we want to make sure the cheeks are nice and high, and then the volume in the eyes as well, and then lifting up the laugh line and smooth out the upper lip bleeder lines as well. So after the treatment, you want to make sure you wear SPF over it, so you want to avoid the sun for a day or two. You might have a bit of few bruises, but it will settle after about 5 to 6 days. If you like, you can take some arnica tablets beforehand and also afterwards, and that will help to reduce the bruising as well.
This is my second treatment, and the first one I can see the difference straight away. It's a kind of pain you can cope with, and it's no more painful than go to the dentist anyway. But if you're going to see, you can see the result, you can cope with the pain. It was a little sore in my upper lips, but sorry, after 2 days that was okay, and nobody see the difference. The only thing, they look at me and they don't know what changed, and they just look and say, "What you done? You look different." And I saw my son a couple of days ago, and he said to me, "I don't know, Mommy, what you done, but you really look younger now. I remember when you were 50 to 60, you just look older than now." But I didn't say anything. But to see your son who is near to you, to see the difference, your friend they don't want to tell you anyway.